My dad had a stroke, so I was familiar with stroke and the complications from a stroke. More than anything else, I've been associated with medical institutions for about 45 years, and I know that research projects take a long time, and sometimes the success is difficult to define. This was different. This was an opportunity to invest in something or become a part of something that saved lives now.
Mobile stroke unit is a response to the incredible time constraints that physicians who care for stroke patients have to operate on.
In the US, every 40 seconds somebody's having a stroke. Responding to patients quickly with medications and treatment is what gives them the fighting chance for a good outcome.
And the mobile stroke unit is a way of bringing the hospital to the patient instead of the patient to the hospital.
My family and I, we consider it a real privilege to be involved in something like this, something which saves lives now.
With visionary philanthropic gifts, we can take much bigger leaps and transform the type of care we provide. And that's what the gift from Henry and Arlene Gluck has provided for us here.
And they really do feel passionate about it because it changes somebody's clinical outcome today.
By developing the processes of care in the mobile stroke units here, establish this as a system that can then be used throughout the U.S. and throughout the world. So it's really going to have a population humanity impact.
It can make a difference between a father spending the rest of his days with his family and walking his daughter down the aisle versus spending the rest of his life in a nursing home.
It's something where we can encourage others to do the same thing and join us in supporting what we think is the most worthwhile of all possibilities that we've seen over the course of many, many, many years. And the people we work with are so committed. This is their life's work, to be a part of something where you're joining people in a common cause that's good for everyone. That's a real joy.